Before we begin, please note, this video is for educational and informational purposes only. It does not provide medical advice, diagnosis, or treatment. Everyone's health situation is different, especially when it comes to blood pressure and supplements. Always talk to your doctor or a qualified healthcare professional before making changes to your supplements, medications, or routine. Never stop or reduce prescribed blood pressure medication without medical supervision. Now let's talk. If your blood pressure has been stubbornly high, you know how exhausting it can feel. You do what you're told. You take your medication. You try to be careful with food. You keep going to checkups. And somehow the numbers still don't move the way you hoped. And what makes it even more frustrating is this. Sometimes you're doing more than other people. You're more disciplined. You're more consistent. Yet you're the one getting told, we may need another medication, or let's increase the dose. So if that's you, I want to show you a possibility that many people overlook. A growing amount of research suggests vitamin D status is connected to cardiovascular health, including blood pressure regulation. But here's the key detail most people never hear. It's not only whether you take vitamin D, it's how you take it. In other words, people can be taking vitamin D for months or years and still get little benefit because they're making one or more very common mistakes. Today, I'm going to walk you through 5 mistakes that show up again and again, and I'm going to do it in a way that's practical and easy to follow, so you can have a smarter conversation with your doctor, and so you can stop wasting time on a routine that isn't working. And yes, we will talk about timing, because that's the mistake that surprises most people. But first, let's build the foundation with mistake number 5. Mistake number 5, taking vitamin D without vitamin K2. Let's start with something simple. Vitamin D helps your body absorb calcium from your diet. That's one of the reasons it's so well known for bone health. But calcium is like cement. It's powerful. It strengthens bones, but it can also create problems if it ends up in the wrong places. Your body doesn't just absorb calcium and hope for the best. It uses a guidance system. And one important part of that guidance system involves vitamin K2. K2 supports proteins in the body that help direct calcium toward bones and away from soft tissues. Now, important note, this doesn't mean vitamin D is bad. It means vitamin D works best as part of a balanced system. If you increase calcium absorption without supporting the direction and handling of that calcium, you may not get the outcome you expect. Here's a simple example many people relate to. Example, imagine someone gets a blood test and their doctor says, your vitamin D is low, start taking D. They do it faithfully, every day, for years. Their vitamin D number on labs improves, but their blood pressure doesn't. They feel confused because they were told vitamin D helps. What might be happening is vitamin D is improving calcium absorption, but if the body lacks the support it needs to manage calcium properly, the cardiovascular system doesn't get the full benefit. Over time, arterial stiffness becomes more of an issue for some people, especially as they age. And arterial stiffness matters because when blood vessels become less flexible, the heart has to push harder to move blood through them. That can show up as higher systolic readings, wider pulse pressure, stubborn pressure that doesn't respond as expected. So what do many clinicians and educators suggest people discuss with their doctors? Often it's the idea of pairing vitamin D with vitamin K2, typically the MK7 form, in commonly used supplement ranges. To be clear, I'm not prescribing anything. I'm saying this is something to discuss with your clinician, especially if you've been using vitamin D long-term. And if you take blood thinners or have specific medical conditions, this becomes even more important to discuss with a professional. Key takeaway. For many people, vitamin D works best when it's not taken alone, but as part of a supported system. Not a mistake. 4. Taking vitamin D in a way that blocks absorption. This next one is extremely common, and it's the simplest reason people fail to see results. They're not absorbing what they're taking. Vitamin D is fat-soluble. That means it absorbs best with dietary fat. If you take vitamin D with water and nothing else, you may be getting only a fraction of what you think you're getting. And I've seen the same pattern repeatedly. People tell me, I take it every morning. Then you ask, with what? And they say, with coffee. Or they say, I take it with breakfast. But breakfast is toast, cereal, fruit, very low fat. So the supplement may be consistent, but the absorption isn't. Now, here's where we make this more useful. It's not just about any fat. Some evidence suggests omega-3 rich fats may support better absorption and also support anti-inflammatory pathways that matter for cardiovascular health. That doesn't mean you need something fancy or extreme. It can be as simple as taking vitamin D with a meal that includes eggs, salmon, yogurt with fat, nuts, olive oil-based foods, or a doctor-approved omega-3 source. Mini story example: two people take the same dose of vitamin D. One takes it with black coffee. The other takes it with dinner that includes healthy fats. After a few months, one person's labs barely change and the other person's labs improve significantly. They think it's genetics. Sometimes it's simply absorption. So if you've been taking vitamin D and your levels don't rise much, don't assume your body is broken. Sometimes it's the timing with food and fat. Key takeaway: absorption is not guaranteed. The routine matters. Mistake. There are 3. Taking D2 instead of D3. This one surprises people because it sounds technical, yet it can make a real difference. Vitamin D comes in different forms. The 2 most discussed forms are D2 and D3. Many over-the-counter supplements are D3. Some prescriptions and older protocols use D2. A lot of modern education emphasizes D3 as the form that tends to raise blood levels more reliably for many people. And it's the form the body naturally produces in response to sunlight. So here's the issue. Someone can be told, your vitamin D is low, take this prescription. They do it faithfully. Their blood test improves a little. But they don't feel better. Their blood pressure doesn't change. Their energy doesn't change. Then later, they learn they were taking a form that may not be the best fit for their goals. Again, not a guarantee, not a universal rule, but a very common pattern. So what do you do with this information? Not panic, not self-diagnose. You simply get curious and check the label and ask your doctor what form you're using and why. Key takeaway: form matters and it's worth confirming. Mistake: using a dose strategy designed for bones, not cardiovascular goals. Now we get to a part that causes a lot of confusion. Many vitamin D guidelines historically focused on bone health. And that makes sense. Vitamin D deficiency is strongly connected to bone issues. But cardiovascular research often looks at different target ranges than just enough for bones. So a person might do everything right. They take vitamin D, they raise their level from very low to barely normal. And then they stop there. And then they're disappointed because their blood pressure doesn't change. This is where testing and personalization matter. Instead of guessing, a safer strategy is test vitamin D, follow your clinician's advice, retest after a few months, and adjust based on results and safety. Because what works for one person may not work for another. Body weight, absorption, sun exposure, diet, medications, and health conditions can all change your needs. Key takeaway: if you never test, you may never know whether you're in a range that supports your goal. Now, we arrive at the most important mistake, the one that many people don't expect. And if you've tried vitamin D for a long time with no improvement in blood pressure, pay attention to this next part. Mistake 1, the timing mistake that may affect blood pressure patterns. Here's the concept. Your body follows a 24-hour rhythm. This rhythm affects hormones, nervous system activity, sleep quality, inflammation patterns, and yes, blood pressure patterns. Most people know blood pressure changes during the day, but fewer people know there's something called nighttime dipping. In many healthy patterns, blood pressure drops during sleep. That dip is a form of rest and recovery for the cardiovascular system. When the body doesn't dip properly at night, it's often linked with higher cardiovascular strain over time. This is one reason doctors sometimes ask about sleep, stress, and even sleep apnea. Now, vitamin D interacts with circadian biology in ways researchers are still exploring. And some clinicians and educators suggest that for certain people, taking vitamin D at a different time of day may support more favorable patterns, especially if they notice sleep disruption or unusual blood pressure timing. Let me make this practical with examples. Example A: a person takes vitamin D first thing in the morning. They also drink caffeine early, they rush into the day. They have stress hormones already elevated. If vitamin D timing reinforces a daytime signal, some people may feel more alert, yet others may notice they're more tense, their heart rate feels higher, or their blood pressure stays elevated longer into the evening. Example B. Another person takes vitamin D with their evening routine, after dinner, with fat in the meal and a consistent bedtime. They notice their sleep becomes more stable. Their evening blood pressure readings improve. Their morning readings gradually improve too, over weeks, not overnight. Is this guaranteed? No. Is it something worth discussing with a clinician if you've tried everything else? Yes, because timing is one of those small switches that doesn't cost anything to test when tested safely and responsibly. Key takeaway: the body's rhythm matters, and timing may influence outcomes for some people. In the next part, I'm going to give you a complete step-by-step discussion protocol you can take to your doctor, plus more examples, common questions, and safe ways to track whether anything is actually helping. Let's pull everything together into something practical. If you take only one lesson from this video, let it be this: a supplement doesn't work just because you swallow it. It works when it's used in a way that matches your body's biology and your specific health context. So here's a safe, realistic framework that many people can use as a starting point for discussion with their healthcare provider. The SMART Vitamin D Discussion Protocol Educational. Reminder: this is not medical advice. This is educational information meant to help you have a better conversation with your clinician. Step 1. Confirm what you're taking. Ask yourself, is it vitamin D2 or D3? Are you taking it daily or weekly? How long have you been taking it? Do you know your current blood level? This matters because without basic clarity, you can't evaluate results. Step 2. Confirm cofactors. If someone is taking vitamin D for months or years, it may be worth asking a clinician about vitamin K2 considerations, magnesium status, dietary calcium balance. Why? Because vitamin D influences mineral metabolism, and your cardiovascular system depends on balance, not extremes. If you take blood thinners or have kidney issues, this is especially important to discuss with your doctor. Step 3. Fix absorption. Ask, am I taking vitamin D with fat? Is it with a low-fat breakfast and coffee? Could absorption be the reason my levels aren't changing? Many people never consider this, and it's one of the easiest fixes. Step 4. Use testing instead of guessing. A safer approach is test your vitamin D, follow clinician guidance, retest after a few months. This prevents random dosing and helps you stay in a range that's appropriate for you. Step 5. Consider timing as an experiment, not a belief. Instead of saying vitamin D must be taken at X time, think like this: if timing affects my sleep, my nervous system, or my blood pressure pattern, I can test it safely with tracking while staying consistent with everything else. That's the scientific mindset. One change at a time, measure the outcome. Why this matters for blood pressure. More explanation, no fear. Blood pressure is not just about one thing. It's a system. Vessel flexibility, nervous system tone, inflammation, sleep quality, mineral balance, stress hormones, kidney regulation, medication timing, hydration, and sodium balance. So when someone says, I take vitamin D and nothing happens, it may simply mean vitamin D wasn't integrated into the system correctly. And here's an important point. Even if vitamin D helps, it usually doesn't help overnight. Many changes are gradual, measured in weeks. That's why tracking matters. Safe home. Tracking simple, not obsessive. If you want to see whether anything is improving, consider tracking blood pressure in a calm, consistent way. A simple method many clinicians recommend. Take readings at the same times each day. Sit quietly for a few minutes before measuring. Don't measure immediately after stress, coffee, or exercise. Record results for trends, not single numbers. Because a single high reading can happen for many reasons: poor sleep, stress, dehydration, pain, even a stressful phone call. Trends matter. If you're testing a change like taking vitamin D with dinner instead of morning, you want at least a couple of weeks of consistent tracking, consistent sleep and meal patterns as much as possible. See if any of these feel familiar. Example 1, my level improved, but pressure didn't. Someone takes vitamin D for a year. Their blood level rises from low to acceptable, but blood pressure stays stubborn. Possible reasons: absorption issues, low fat routine, missing cofactors, timing that disrupts sleep or nighttime patterns, dose strategy that raises labs but doesn't support the goal. Example 2, I take vitamin D and I feel jittery. Some people say vitamin D makes them feel more wired, especially if taken with coffee in the morning. That could be coincidence, or it could be how their nervous system responds. In those cases, timing and pairing with food may matter. Example 3, my evening pressure is always worse. Some people notice morning reading is okay. Evening reading climbs. Sleep is poor. They wake up tired. This pattern can be connected to stress physiology and sleep quality. In those cases, focusing on routine consistency, timing, food pairing, sleep hygiene often matters more than people realize. Example 4, I'm doing everything but nothing works. This is the most emotional one. And this is where I want to say something important. High blood pressure is often not a personal failure. It's often a multi-factor system that needs adjustments, one by one, until you find what actually moves the needle. It's what not to do keeps it safe. Let's be clear about safety. Don't stack high doses of supplements without testing and guidance. Don't assume more is better. Don't change prescription meds without your doctor. Don't treat a YouTube video as a substitute for medical care. The goal is not to self-treat. The goal is to become informed so you can work with professionals more effectively. Yes, the full evening routine. Template educational. Here's a simple, organized routine template you can discuss with your clinician. Take vitamin D with a meal that includes healthy fats. Consider whether K2 is appropriate for you. Ask your clinician. Keep timing consistent. Track blood pressure trends. Retest vitamin D levels after a few months. Simple, structured, measurable. And final summary, repetition for retention. Let's recap the 5 mistakes. Mistake number 5, taking vitamin D without considering K2 balance for some people. Mistake number 4, taking vitamin D without fat, poor absorption. Mistake number 3, using D2 when D3 may be more effective for many people. Mistake number 2, guessing dose and never testing levels. Mistake number 1, ignoring timing and the body's daily rhythm, especially if sleep and nighttime patterns are an issue. And remember, you don't need to do everything at once. You can fix the routine step by step, track outcomes, and discuss it with a professional. The final disclaimer, call to action. Once again, this video is educational only. It does not replace medical care, diagnosis, or treatment. Always consult your doctor before making changes to supplements or medications. If you found this video helpful, share it with someone who's struggling with high blood pressure, because so many people are taking vitamin D, but taking it in a way that may not help them. And if you want more evidence-based, practical health strategies explained in a clear way, subscribe. Also, tell me in the comments, which of these 5 mistakes surprised you the most? Thank you for watching.